to the person that's lower on the spectrum or dealing with, recovering from surgery or dealing with a neuropathy or like a fasciitis or some sort of inflammatory, more acute situation, getting onto an anti-inflammatory diet, which would be, getting out all the packaged processed foods. I refer to them as the toxic and inflammatory foods: gluten, dairy, soy, corn. And then potentially looking at your gut and healing your gut, to me, has the biggest impact. I mean, for the people that are not as complex, those two things are huge.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. Welcome to the NeuFit Undercurrent podcast. I have a very special guest today, Dr. Amy Myers, who is one of the leaders in the field of functional medicine. And today we are going to talk about functional medicine, which I'll introduce a little bit first before we get into Amy and some of her background. But functional medicine is doing for health and medicine what we're doing for pain and injury and rehabilitation, trying to get to the root cause, trying to be proactive instead of reactive. And I think for us, when we're talking about rehabilitation and performance and sustaining performance over the long haul, we know it's very important to have a strong foundation of underlying health. And this functional medicine paradigm, I believe, is the most powerful way to create robust underlying health that can support people in recovering and performing and all these different goals that people are seeking out NeuFit providers to achieve. So segue into Amy here. Amy Myers is a medical doctor. She started working as an emergency medicine physician in the early 2000s and transitioned into functional medicine. She had a practice here in Austin starting in 2010 or so, and she was actually practicing seeing patients here in Austin for many years. And that is when we met, which we'll talk about a little bit here. And then she also has grown her business now and is probably best known for amymyersmd.com, her website, where she has a wealth of health educational information and also some very excellent high quality health products, nutritional supplements, and the like. Also, she has two best-selling books, The Autoimmune Solution and The Thyroid Connection, both of which are excellent. She's been on Dr. Oz 7 times and now NeuFit Undercurrent 1 time. So we'll see if we can catch up there. She also has one patent. That's something that we share. She has a patent in the field. Maybe we'll get into that today, maybe not. But Amy, welcome.
Hi, so good to be here, finally.
That's right. We've been talking about doing this for a while, and I'm really excited to have you on because this will be a new topic that we haven't yet covered in our 60-something episodes so far, but it's really important. It's the underlying, it's everything, underlying health, that if you don't have that, none of the other stuff really matters. So I think it'll be very good to get into a foundational topic. To kick us off here, can you tell us how you made that transition from emergency room physician into functional medicine?
Absolutely. It's kind of a long story, but I was a Peace Corps volunteer in Paraguay, South America, and spent a lot of time learning about herbal remedies and natural health, and came back from that experience wanting to go to naturopathic medical school, and actually moved out to Seattle to potentially go to Bastyr. I had to do all my post-bac pre-med since I was a psychology major. And in that experience saw that they were really not valuing an ND the same way as an MD. And this was, where the main school was. So I decided to become an actual MD, a medical doctor, through allopathic medical school. But my roots really were all along in sort of holistic medicine, what I now call many people call functional medicine. But back then, there really wasn't a lot of functional medicine. So I didn't 100% know what I was looking for. But I moved back to New Orleans and went to medical school, and I took all my electives in integrative health. I started an integrative health program, helped them get complementary and alternative medicine spun up at LSU in New Orleans, and eventually went and spent a month with Dr. Andrew Weil in Arizona. And still could not find what I was looking for. So I realized if I did emergency medicine, I could at least go back and do third world medicine and help do international health and whatnot if I never found what I was looking for. So I completed my residency in emergency medicine, and then a few years in, moved to Austin to work in the ER, and went to a conference and heard for the first time about functional health, functional medicine. And that was it. The first time I heard about it, I knew it was exactly what I had been looking for all along. And the great thing about being an ER doctor was it is a place that I do believe that allopathic medicine does a really good job. I don't think they do a great job in sort of this chronic illness. I think functional medicine's much better for that. But if you get shot or you're in a car accident, you absolutely want to go to the ER. So I could believe in that. And also, it made it very easy for me to get out of the ER and start my own practice versus having a practice and then having to convert it over to a functional medicine practice. So it didn't seem like the two were connected, but I had my eye on the prize the whole time. It took me a while to find it. And once I found it, I really, dove headfirst in and opened my practice.
That's awesome. I can definitely relate to that, just that feeling of seeking better solutions, and then that the joy and the energy you get when you really find it like that. That's awesome. And when you found functional medicine, just so everyone is on the same page and we're speaking the same language, how would you describe functional medicine if you had to put it in a few sentences or a paragraph?
So it's a systems-based approach, and it really gets down to the root of what's going on with you. In medical school, I was taught that if I heard someone had heartburn and migraines, that they get an acid blocker and they get migraine medicine, or maybe they go eventually to the gastroenterologist and to the neurologist. So they're not seeing the systems as a whole, and they're not seeking to find the root cause. They're literally hearing a problem and giving a pill for it. And, no fault. That's exactly what we're trained to do in medical school. So in functional medicine, I was trained to think, how might these two things be related? Could it be that you got a parasite when you were traveling to India? Do you have a gluten sensitivity? You treat the parasite, you get off gluten, the migraines go away, and the acid reflux goes away. And so it's really looking at how everything potentially could be connected, and then how do you get to the root cause and find the solution instead of just treating things with pills.
I love that. So if we can get to the source, get to the root cause, then there's an opportunity to affect change in many different variables. And in terms of what some of those root causes are, or the biggest levers to pull, I want to frame up this conversation by one, talking about the 80-20 principle. What are the few things that are going to get us the greatest results? And then also think about, that can be context dependent, of course. So there could be different populations. So if we're talking about people who are, seeing a physical therapist or chiropractor because they're recovering from an injury or a surgery, and so they're interested in connective tissue healing or overcoming chronic pain, perhaps neuropathy, something like that, or some sort of neurodegenerative condition. And then also clinicians listening to this who wish to have the vibrant energy that they need to get through a day of treating patients or helping clients with their different goals and still have energy left over when they get home, stuff like that. So all right, we'll kind of gear it around those populations.
In both of my books, I talk about I call my program the Myers Way, and there are 4 pillars to it, or they're sort of what I consider 5 root factors that pretty much any chronic condition generally falls into one of these. And that is our diet, looking at toxic and inflammatory foods, looking at our gut. Many of us have leaky gut or, dysbiosis, imbalances going on in our gut. Looking at toxins. We live in a very toxic world these days. Looking at infections. And when I say infections, I mean like latent infections such as Lyme, herpes, Epstein-Barr. We can now say long COVID in that list as well. And then stress or trauma. So, I could have 2 people coming into my office with Hashimoto's or lupus, MS, and, their root causes may be vastly different. Now, I would argue, and the work of Alessio Fasano who's really done a lot in the movement with leaky gut and is the person who really found the molecule and named zonulin, which is released when you have a leaky gut. His research showed that with autoimmunity that you likely have a leaky gut, and then there's some sort of trigger, and gluten is generally involved in that as well. So, but short of that, there may be one person that has a really traumatic event that's happened, and someone else may be living in toxic mold or have long COVID or some, an infection or something else might be their trigger. So just because two people have the same disease or named disease, and this is also how functional medicine is different than conventional medicine. In conventional medicine, it's like everybody who has MS, here, take these drugs, right? And they're not looking at anybody as an individual. In functional medicine, I'm always listening to the health history of the patient and treating them as an individual. And so for one person, it may be, that they're in an abusive relationship. For someone else, it may be that they, work in an office building that's had multiple leaks and water damage in the building and there's toxic mold. For someone else, it may be, an infection, a latent infection such as Lyme or COVID or something like that, that is their trigger.
So there's going to be some of these things in order to diagnose and treat infections. Some of these things people are going to have to work with a physician in order to do. Some of these, like you mentioned, leaky gut is sort of the first one that seems to come to mind, because that often is a really big influence or first domino when there's different issues, whether get to the chronic disease state or just people feel like they don't have enough energy or they have some brain fog or a little less vibrant than they wish to be, right? So it seems like that's one. Can you talk to us a little bit about what leaky gut is? You mentioned zonulin,
Sure.
just to make sure everyone understands what it is, and then what we might be able to do about it to know if we have it, to maybe possibly to improve it on our own, or if all of that needs to be done with a physician, or if there's some things people can do for self-care as well.
Sure. So, and I didn't fully answer your last question. I also talk in my book, The Autoimmune Solution, about an autoimmune spectrum. So if you're high up on the spectrum with a diagnosis of autoimmunity, you likely have many of these things going on. And if you're lower down on the spectrum, you may have one or two or none of them going on. And so depending on where you are in the spectrum, and you ask biggest bang for your buck. So, assuming that many people that are potentially using the NeuFit and going to physical therapists maybe are lower down on the spectrum and dealing with neuropathy or one of these situations, all the way up to somebody with full-blown maybe MS or something. So back to the biggest impact, I remember when I started my practice, somebody told me, don't worry about it. Diet and healing the gut solves most all of it. And that was true at the beginning of my practice, right? When I was unknown and I was seeing the people with the migraines and the neuropathies and the, irritable bowel and the reflux, I got them on a low inflammatory diet. So, at the time I wasn't seeing a lot of autoimmunity. So it was just getting gluten out, dairy out, corn, soy, and then of course all the processed packaged foods, sugars, wine, alcohol, things like that. As I begin to see, as I write a book and people are starting to see me from all over the world, and having multiple autoimmune diseases, that no longer stood. People were already coming to my clinic, having read the book, having done the program, and, they needed a lot more advanced testing and things like that. So to the person that's lower on the spectrum or dealing with, recovering from surgery or dealing with a neuropathy or like a fasciitis or some sort of inflammatory, more acute situation, getting onto an anti-inflammatory diet, which would be, getting out all the packaged processed foods. I refer to them as the toxic and inflammatory foods: gluten, dairy, soy, corn. And then potentially looking at your gut and healing your gut, to me, has the biggest impact. I mean, for the people that are not as complex, those two things are huge. And so back to what is leaky gut? Well, our gut naturally sits together with these tight junctions, and these little fingers are the finger-like projections of our villi. So our gut is normally semi-permeable, meaning that this opens up a little bit. I like to think of it as a drawbridge. The big boats cannot get through, but naturally it opens a tiny bit to get in those macro and micronutrients after it's gone through the digestive process. you know, and so when your gut is leaky, these tight junctions or those drawbridges are open. And then zonulin is released. And one of the thoughts is that gluten can cause zonulin to be released, which then keeps these tight junctions open. When those tight junctions are open, then larger molecules that were never meant to get into our body or our bloodstream get in. So things like the casein molecule from dairy, the gluten molecule, these are very large molecules. A, herpes particle or an Epstein-Barr particle. These are very big molecules that are never meant to get into our bloodstream because you have your gut sitting there. Our gut is where 80 to 90% of our immune system lives. It's only one cell layer thick right there, our gut. And so as these large molecules come through, your immune system's sitting right there under your gut. And so it goes on high alert to attack these molecules. Now, one of the leading hypothesis to autoimmunity is that there's this process called molecular mimicry, which is that the gluten molecule can look very similar to other tissues in our body, such as our thyroid molecules. And so as this gluten molecule comes through, because you have a leaky gut, your immune system goes on high alert to go attack the gluten. But because your thyroid can look very similar to the gluten, it can inadvertently attack your thyroid. And that is one of the leading hypotheses towards certainly Hashimoto's and many other autoimmune conditions. So you want to do everything that you can to heal up your gut. Now, we can get into what causes leaky gut. Many people are born with it now. We are born with C-sections, antibiotics. People are on acid reflux medications, so they don't have enough acid to ward off things like SIBO or Candida, and SIBO is small intestinal bacterial overgrowth. Medications can cause leaky gut. Stress can cause leaky gut. Over exercise can cause leaky gut. Now, sometimes these things, Alessio Fasano says every time anyone eats gluten, it causes leaky gut. But in a healthy individual, that, your gut cells are turning over every 24, 48 hours. They're quick turning cells, and that your gut will heal. But if you have these constant bombardments, you're taking an acid reflux medication, you're eating gluten every day, you're stressed out, you get antibiotics, this leaky gut or those drawbridges stay open. And when they're chronically opened and you have these molecules that aren't supposed to get into your bloodstream, and your immune system's on high alert all the time, this becomes a chronic inflammation that then can lead into autoimmunity. So healing that gut is the first step that I use to help reverse autoimmunity and to help heal any type of, inflammatory condition. So I say that the gut is the gateway to health. And if you don't have a healthy gut, it's difficult to be healthy.
And if you're talking about that progression leading to autoimmunity, I think, as you mentioned, that spectrum or that continuum, even for people that think, oh, I don't have an autoimmune condition, that's not an issue for me. If you ever feel brain fog after a meal, or if you ever feel like your energy is compromised or something, I mean, those can also be signs of a leaky gut, right? Too.
Well, when I hear somebody feeling foggy after a meal, I think about food sensitivities. I mean, one, you could either just literally be eating too many carbs and you have blood sugar imbalances, and that can cause you to be sleepy after a meal. Brain fog, sleepy after a meal can also be food sensitivities. And a food sensitivity is different than a food allergy. A food allergy is an IgE mediated response, which is you eat something, you break out into hives. And that is, you go to your doctor, you go to the allergist, that shows up on a blood test. Food sensitivities are IgG mediated responses. And you can do a regular blood test through the regular lab now, but there are 4 components of IgG: IgG1, 2, 3, and 4. And the lab doesn't always check all 4 components. And food sensitivities are more difficult to diagnose because they can take several days to come out, which is why I have everyone do basically what's called an elimination diet. And that is getting out all these toxic and inflammatory foods for at least 30 days, and then gradually adding them in one at a time and eating it pretty consistently for 3 days and tracking to see, do I feel tired? Did I get anxiety? Do I have headaches? Do I have digestive issues? Do I have allergies? I mean, it can come out in so many different ways, which makes it difficult to diagnose. Um, and people aren't tracking, oh, I had that pizza 3 days ago and now I have a migraine, right? They're figuring if they were going to get a migraine from the gluten, they would have gotten it right away. But with an IgG mediated response, that is not necessarily true. And so these can be difficult to diagnose. Now, there are, through functional medicine labs, there are, food sensitivity tests that you can take. I believe your body knows better than any test. So yes, I did many, many, many food sensitivity tests in my clinic, but I also had people go through an elimination diet. And between the two things, knowing how you feel and seeing it on a lab test, it gives you a lot of information, but your body knows better than any lab. So if something doesn't come up positive that you have a gluten sensitivity, but every time you eat gluten, you get a migraine, well, I think your body kind of knows that let's go with your body that gluten's not a great thing for you. So brain fog in general, one thing that I really think about that isn't necessarily consistent with a meal is candida overgrowth, which is something that I, of course, saw all the time in my clinic. And I would say really candida overgrowth and small intestinal bacterial overgrowth are two of the most common conditions that I saw in my clinic that absolutely can lead to leaky gut, but a whole host of other issues. And now, recently, SIBO has become an ICD-10 code that the gastroenterologist can code for. And so you're seeing a lot more people talking about it. There's an antibiotic that's extremely expensive to treat it. But, now you have a doctor that's been told there's a gold standard test that you can get through your regular doctor. It's called a hydrogen methane breath test. So there's a test, there's a diagnosis, and there's a very expensive drug to treat it. So the trifecta of now it's becoming widely known. But 10 years ago when I was talking about this, nobody was listening. And you could not walk into your GI doctors and get a test. I mean, it was just the extreme cases. So, but candida overgrowth is still, there's no code for that. there is treatment and all this stuff, but it's, there's no diagnosis code. So therefore it doesn't exist in the regular medical community. But
yes, funny how that works.
Yeah. So but quick, back to your thing. Yes, there are functional medicine tests you can get for these things. I have many free articles on my website that describe what are the symptoms, what are the signs, how do I treat this? And more importantly, I have some quizzes that you can just take for free on my website that will give you a good indication of whether you have these. And then with SIBO, for example, the antibiotic was very expensive back then and very difficult to get insurance to cover. Now, equally, but it's improved a bit. So I created supplements, an herbal formula called Microbe Clear, and a probiotic that's a soil-based probiotic to help treat this. So and I have a program and all that stuff on my website. If you're interested, or just a kit, you can get the stuff, but it works really well. And same thing with candida. I just saw these infections so commonly, and getting a regular physician to write for diflucan or nystatin and to write it for a month. I mean, the women out there might have heard of these antifungals for yeast infections. And as you know, you get one, 2, if you're lucky, maybe 3 pills, and they say it's gone. But to treat it systemically or in your gut, it takes about 30 days. And so finding a physician to write for that's very difficult. So again, I created some enzymes that help digest the yeast cell wall and caprylic acid. So I've created programs and formulas to treat these things because so many of my patients were having difficulty, either being able to afford the antibiotic, or, of course, after I wrote these books, people didn't always have a physician to be able to treat these things for them.
That's great resources there. So definitely going to amymyersmd.com and looking at those quizzes and having a trusted source of information when there's a lot of, less good quality information out there, especially on some of these topics, is a great resource. And we'll have links in our caption here to where you can check out. And there's also you're also going to share a free gift, a free report, right, with our audience here too at that link.
Yes, 35 gut healing recipes and information about leaky gut and how to heal your gut. And we can certainly get into the 4-hour program if you'd like as well. So really,
Awesome.
what I offer is full-on solutions for all of this. I mean, I do think that that's one of the things after working for nearly a decade in my clinic and just seeing how desperate people are for solutions. That's what I try to offer. And there are many, free guides and solutions on my website. And then, in some cases, you may need some nutritional supplements to overcome things in the short term as well.
That's awesome. That's awesome. One thing I just want to repeat or underscore, highlight a little bit that you mentioned there was the elimination diet and the fact that sometimes there can be an issue that pops up maybe 3 days later and people would never think to make the connection unless it were so structured. So sometimes with these really difficult, conditions and situations, doing something like that where you're doing a full month of elimination diet is, these are the types of things that you need. If you want to get big results, sometimes you need to take big action.
Right. I mean, you can go get a food sensitivity test. They're not all created equal. And what I found, because I did literally thousands of these, is that some people would come in and it would say 45 foods. Well, what does that mean? I mean, are people really sensitive to almonds and avocados? Well, no, they were just eating a lot of almonds and avocados and they've got a leaky gut. So as soon as they healed their gut, you stay off the almonds, you stay off the avocados for a while and you heal your gut, and then you should be able to go back to them. Now, when people showed up gluten and dairy or corn or some of these very inflammatory foods, I would recommend, particularly if they had autoimmunity, that they stay off of them lifelong. I think one of the greatest things that I helped people with was to understand how things affect them, from their environment to their relationships to the foods that they're eating, and understanding, okay, I can have corn if it's organic twice a month and I'm fine. I can eat a cupcake, a gluten-free, dairy-free cupcake on my birthday and my daughter's birthday. But do I want to be doing these things every single day? Likely not. And so it's really learning, what are your absolute no's? I mean, I remember being at dinner, with a bunch of my friends, and the, cake shows up, all apologizing to me. And I'm like, oh, I didn't even notice it. It has gluten and dairy in it. I know that I cannot eat that. I will have, even if I don't have overt symptoms immediately, it could be affecting my immune system deep down and stimulating my immune system for up to 3 months. And I have a history of autoimmunity. We didn't get into my history with Graves' disease and how I became so passionate about autoimmunity. But, so I didn't even notice the cake. It's not, now, if it had been chips and salsa, that might have been a little different. I don't do so great with tomatoes, and corn's not the greatest food. Can I eat it every once in a while? Yeah, that would have been way more tempting because I know that I can eat it occasionally without having a big inflammatory reaction. But the gluten and dairy-filled, sugar-filled cake, I didn't even notice it was sitting on the table because it's just a no for me. It really makes life easy, actually.
That's true. When you can have those clear rules to follow, it kind of takes away the choice.
And, I saw a lot of children and the parents would come in so, distraught. And I said, don't worry. Your child is going to know after this exercise. They're going to know how food affects them and they are going to start policing it. And it's true. I mean, the children come in and they're like, no, I know that caused my daughter, she has a dairy sensitivity. And one night she had pizza with real cheese on it and she had the worst stomach ache and she doesn't want to go near it now. So, once you know these things, it really makes life kind of easy.
If you're ready to supercharge your practice, listen to this. Garrett and Team NeuFit have just released a new online course entitled Introduction to the NeuFit Method. In this detailed 8-hour course, you'll gain mastery of the fundamental techniques in our practice, including muscle testing and activations, nerve glides, and joint articulations. You'll also get introduced to our patented direct current stimulation device, the Newbie, an incredible machine that's empowered professionals just like you to help their patients heal, adapt, and grow faster than they ever thought possible. To learn more, go to www.neu.fit/learn. And now back to the show.
Mm-hmm. Two quick things I'll share. One is my personal experience with eggs. I used to eat, a lot of eggs. Just knowing all the different nutrients in it, and good protein, good fat, a lot of micronutrients. And I also, for several years, had a minor rash on my fingers, and I always thought it was from my hockey gloves. And because I could run them through the laundry, but they never really quite get clean enough. So I always wrote it off. And then I went for the first time, since I was a kid, I went like a month without playing hockey for the first time, and I noticed like, that's weird. Why do I still have this? And I stopped eating eggs, and literally in 3 days it was gone. Never to return. So this stuff does make a big difference.
Mm-hmm.
And
And
then
conventional medicine is never going to do that unless you had an IgE reaction. Conventional medicine is never going to pick that up.
right. So we talked about the gut. If you're able to heal the gut, you likely can return to some of the foods that one is sensitive to after the gut's healed. Likely you can reintroduce them and be okay, right? I want to make sure we got that point. I know
Absolutely. And the caveat is, if you have an autoimmune condition because of that molecular mimicry with gluten, I would not eat it. No matter what any test says, no matter how you feel, I would not eat it. And then there is molecular mimicry between the casein molecule and the gluten molecule. And so for that reason, I say no gluten or dairy. Now you might be able to do sheep's, dairy or goat dairy, or, raw. You got to figure it out. But in general, gluten and dairy, the dairy that we have and the gluten that we have now in 2023 are two of the most inflammatory foods. So if you have autoimmunity, I do not recommend, you going back to that no matter what any test or anything says.
Good. So the excellent overview on leaky gut. We know there's some resources for people who want a deeper dive on that topic on your website. Let's transition here and talk a little bit about, we've got these other 4 pillars, but also want to talk about, energy and vitality, and something that you mentioned briefly is thyroid. I know your story from your book, from the thyroid connection, and the experience you've had. But can you educate people here just a little bit on what thyroid hormone is, why it's important, and then we can talk about different influences that affect thyroid function.
Sure. So your thyroid is a butterfly gland that sits right here. I don't have one. Mine was ablated because conventional medicine failed me. And it was my mission to not have it fail you too. And so it is your master gland. It regulates your metabolism. It regulates the rest of your hormones. There are receptors on every cell in your body for your thyroid. So it is something that is, look, when you have Graves' disease like I did, it's generally not overlooked by conventional medicine. They generally pick that up. But Hashimoto's or hypothyroidism, low thyroid, is often overlooked. And I write about that in my book, The Thyroid Connection. It's a book that you can work with a conventional doctor. I go over what tests to order, what the reference ranges are, what's optimal versus normal. When they came up with the reference ranges for thyroid, they were using a lot of hypothyroid people. Even the Academy of Endocrinology years ago advocated to decrease or narrow the reference range. There's normal and then there's optimal. You certainly want to have optimal. And, for those people out there who are on thyroid hormone, I like to call it thyroid hormone because that's what it is. It's not a medication. If I didn't take thyroid hormone every day, I would eventually die because I don't have a thyroid. So it's a life-saving hormone. And, I've helped many people reverse their Graves. I've helped many people reverse their Hashimoto's. If they're early in the spectrum, they may be able to get off their thyroid hormone or never have to go on it. If they're very, very late in the stage and much of their thyroid has already been damaged or some of it, they may need to stay on life-saving thyroid hormone for the rest of their life, and that's not a failure. But you for certainly still doesn't mean like, okay, well, I don't need to listen to her anymore, and I don't need to fix my gut, and I don't need to figure out the root cause. Absolutely, you do, because one, you still want those antibodies to go negative. You want to squelch the fire in your body. And those of us with autoimmunity, once you have one, you're 3 times more likely to get another. And if you do not heal that gut and squelch that fire, you're leaving yourself open to that. And next time it may be something way more debilitating than Hashimoto's. It may be lupus or scleroderma or MS. And so you don't want to, in my opinion, take that chance.
And for people who don't have any of these, clinical thyroid issues, anything that serious, you mentioned that every cell in the body has receptors for thyroid hormone. So it's related to energy. What are some of those basics that even people who just, don't have those clinical level diagnoses or issues, but other things that can help, why it's relevant for energy for the rest of us also?
Well, when I wrote the Thyroid Connection, I decided that, when I wrote the Autoimmune Solution, it was my first book, and I, recommended a lot of supplements, and it was overwhelming for people. So when I went to write the Thyroid Connection, I thought, I'm just going to have one main supplement here. So I formulated the Myers Way multivitamin to correlate with that book. And it's actually the #1 bestseller on my website. And it is a very complete multivitamin. It's 6 pills, and it has what you need to support your thyroid. So there's a whole controversy about iodine. There are advocates of taking 50 milligrams, not micrograms, 50 milligrams. I recommend 300 micrograms in my book. There's a whole controversy about iodine. Back in the day, we were eating sea vegetables. Our salt was iodized. So one, we're not getting the iodine that we used to. And then we live in a brominated, fluorinated, chlorinated world, right? There's chlorine in our water system. There's fluoride in our water system. There's bromide in our baking products. And so these halides displace iodine in our body. And so not only are we not getting enough iodine, we're then bringing in these other halides in large proportion, and they're displacing the iodine. So there's iodine, there's vitamin A, there's B vitamins, there's zinc, magnesium, calcium, all the things that you need for your thyroid to optimally function. And as I don't know who's been on your podcast to talk about, our food supply. I mean, we are not eating the food that we used to eat. Now, one might hope that the people listening to your podcast and that are seeking out things like NeuFit are eating a more nutritious, nutrient dense diet than the average person out there eating a SAD diet. But still, there's a lot of studies that, our soil is depleted. It doesn't have the nutrients that it used to have. So a carrot today is not the carrot that our grandparents ate. And then we're also being bombarded with all of these toxins, and we're stressed out because we have, a phone 24/7 that anybody can get in touch with you. We have leaky guts. We're not absorbing the nutrients. So it's a whole thing of our soil's depleted. We're not eating, even if you're eating a nutritious diet, it's not as nutritious as our parents or grandparents. We're being bombarded with stress. We're being bombarded with EMFs. We have leaky guts. I don't mean to scare people, but you can overcome these things. And I do believe that everyone should take a multivitamin. I have 4 what I call essential nutrients. We have a kit, the Myers Way Essentials, and it is a really high quality multivitamin. And I would pit mine against any multivitamin out there. And I actually wanted to add more calcium and magnesium to it. It was going to make it 10 pills. And I figured people were not going to take 10. They have a hard time taking 6. So I backed off. So I wanted it to be even more potent than it is. Multivitamin, fish oils, omega-3s, probiotic, and then vitamin D. And those are really what I call the essentials that everyone, from baby up to a centurion should be taking every day because of the world that we live in now and the diet that we're eating.
That's a good segue into, so these basics, the multivitamin, vitamin D, fish oils, we want everyone to have. What are the kind of analogous blood tests or blood markers that you would generally want virtually everyone to look at if they're able to, work with someone who can order these, or working with, like, Inside Tracker or one of these other companies that can do it, or what are your
So
go-to
my
biomarkers?
my favorite test, and this is a functional medicine test, or something called an ion panel. So what it looked at was intracellular levels, not serum levels. So what's actually getting into the cell, which is where it needs to be used. And it also looked at metabolically how you were utilizing different nutrients. So, if you go, and many of my patients did, and got a vitamin B level, B12, that's just a common, you can go to your doctor, could I get a B12 level? Well, it doesn't really tell you much. If you're taking B vitamins, it really doesn't tell you much. It just tells you, yeah, you got a high level, but how are you actually utilizing that? Do you have mutations at MTHFR? Can you not methylate your B vitamins? So you might have high B vitamins, but you're unable to methylate them because you have mutations like I do, and many of the people that I saw did. And so they weren't metabolically able to actually use them. And so, of course, all of our supplements have pre-methylated B vitamins in them, because there's so many people with at least one mutation, if not two, that I saw in my practice. And that's really where the money is how is your body utilizing these things, and not what does your serum level say. If you're taking a supplement, generally speaking, if you check your serum level, you would hope that you would have adequate levels. So a lot of my patients would have really sky high levels, but then we would do an ion test and see like, wow, they actually even need more because, they have all these mutations and they're just not able to actually utilize it. So, it's important when you are looking for supplements is looking at, is it in a bioavailable form? Is it, high quality? Is it third party tested? Is it, in the form and in the amount that your body can actually utilize. And a lot of B12 out there is not actually, it's in cyanocobalamin, and that's often what makes supplements less expensive, is that they're using a less bioavailable form. And so it is one of those things where you get what you pay for. But if you're working with a functional medicine doctor, and then I also know there are a lot of these online lab places that have popped up, but it's called it was Genova was the company, and it was an ion panel. And it also looked at, biomarkers in your upper gut for candida overgrowth. It would give indications of SIBO. So it was a very comprehensive, and it looked at, omega-3 levels, many of the vitamin levels, looked at your neurotransmitter levels. It was a very comprehensive test. And that was my favorite one. Getting, if you get your omega-3s checked, I think now you can get that through a regular lab because those are fat soluble vitamins, just like a vitamin D. Those are accurate or, adequate. That's not something special. So your levels there would be, of value. And that's something that you could get through a regular lab. So any of the fat soluble vitamins, vitamin D, vitamin K, vitamin A levels, and then, your omega-3 levels.
That's an interesting insight here. Even just for me personally, I've been doing blood tests, 2 or 3 times a year for the last several years, and I, look at my spreadsheets to look at trends and stuff. But looking at the intracellular levels versus serum levels is a good insight there. So I appreciate that.
So homocysteine.
Mhm.
Homocysteine is an indicator of how well you're methylating your B vitamins. So, I mean, there are some workarounds, but just getting for me, a homocysteine level would be more valuable than a B12 serum level.
Okay, that makes sense. Can you just describe? So you talked about a couple of things there that I want to make sure people understand, because I think they're important and worth a little bit of a deeper dive. But like you mentioned, the source of or the type of B12, for example. So cyanocobalamin, that's actually the same prefix as cyanide, right? So I think people would think they'd want to avoid that. But methylcobalamin is the methylated form. You can get methylated forms of folate as well. Can you just describe what methylation is? It's also relevant, these tests that show people like see your true age. If your biological age is less than or the same, or hopefully not older than, but your chronological age. So that looks a lot at methylation clocks too. So this is an important topic, but can you just
Yeah.
describe what
So
methylation is?
I am not a methylation expert, just to be clear. And if you're looking for one to interview, Dr. Kara Fitzgerald, who's a dear friend, is one, and you could interview her. But methylation is we methylate. Okay, so when various compounds come into our body, our hormones, so we methylate out our estrogens as we bring in toxins. Methylating them out is one of the things that we do. And so you need part of our detox pathways in our liver. Going through this methylation process is part of the ways that we break down our own hormones and toxins and other molecules that come into our system and get them out. Now, if you're taking cyanocobalamin and you have no methylation issues, you may be able to methylate that in your own body. So you taking cyanocobalamin could be fine for you, and then you have to convert it to methylcobalamin, and then it helps with many other molecules in our body to help get toxins out. Now, if you're a person, and I don't know the percentage of the population, but I think it's about 25% has at least one mutation at MTHFR, and this is only there's COMT. There are a lot of different SNPs that help us to methylate, and the more SNPs you have, the less you methylate. And you can also do genetic testing. 23andMe now will tell you this. Back in the day, it did not tell you this. You had to sort through all those SNPs yourself and get someone else to figure it out for you. Also, there are functional labs that have come up and just made panels for like just a methylation SNP panel, and it will tell you very clearly how many you have. And because I saw so many people with chronic illness, part of many people's problem in getting into the boat of chronic illness is not being able to methylate, because they don't get rid of toxins. So those build up, and then that leads to the inflammatory cascade. So methylating is a very important thing that we do. In fact, as we as females all of us break down our hormones, men and women. And, let me back up and pause. Breast cancer, certainly when you have a hormone receptive positive breast cancer, one of the risk factors they say is, early menarche, late menopause, not having children. And that is because, and they say you've been exposed to estrogens for too long, and that has created your cancer. Well, that is not really the whole picture. The whole picture is, as we methylate out the estrogens, there are forms of estrogen in this breakdown that are good estrogens, and they're ones that are bad estrogens. And it's actually how you methylate out these estrogens that is the larger predictor of breast cancer for one of these hormone positive. It's if you're not methylating out your hormones properly, and they're creating the more toxic forms of estrogen, and those are in your body circulating for longer. So, we have a product called Estro Protect that has DIM and B vitamins, and it, helps this methylation process. Again, I know these things on myself. I know I don't break down my estrogens well. And so it's a product that I take every day because I want to help sway that cascade into the breaking down of good estrogens versus the bad estrogens. So this is happening with all kinds of toxins and hormones and our stress molecules, caffeine. All of these things need to be broken down, and methylation is one of the processes that helps to do this. Another thing we haven't talked about is glutathione, which is the biggest detoxifier in our body. And there's also SNPs to see, do you make glutathione, and are you able to recycle the glutathione in your body? Again, I know on myself, I don't do this well. So you really want to take acetylated glutathione. You don't want to just take regular glutathione. It'll get broken down in your gut. Or you want to take the precursors, which also play a role in methylation, which is like alpha lipoic acid and milk thistle and NAC. NAC became very popular, or at least in my world, well known with COVID, that this, there were a lot of people taking NAC with COVID. Who knows, maybe that was helping to, the process of methylation and getting that out of your system. But anyway, that was sort of a very roundabout question because I am not a methylation expert, but from my understanding, part of the reason that some of us get in these boats is because we have these SNPs and we don't detoxify well and we don't break down things well. And so for that reason, it was very important to me to make sure that we had the most bioavailable forms of B vitamins, glutathione, to help people overcome these SNPs, because you can, I can't change my SNP, but I can certainly overcome these, handicaps. I don't know what you want to say, but there are ways to overcome them. Of course, ways to do it with real food as well, eating cruciferous vegetables, which of course I do and recommend. And, knowing my genetics and repeating tests on myself and many, many other people, supplementation is also very helpful in these situations.
Yes, for sure. If anyone listening, we said said SNP many times. Just so people didn't know, it's a single nucleotide polymorphism, I believe. Which, if we have genes, you have genes from mother and father, and you can have different versions or different copies of genes that might make greater or fewer of the proteins and enzymes that facilitate with methylation or any of the things that these DNA that DNA would code for. So people have these, this greater or lesser potential to methylate or to do these different processes in the body, but just like you said, they can be compensated for. I just want to make sure everyone understood what that.
And also, this is the theory behind epigenetics, right? We used to think our genes were static, and now that we've discovered these SNPs, and we know that things can get turned on and turned off or overcome, right? I mean, so through diet and lifestyle changes and supplementation, or even meditation and gratitude and many other things, you can, why does somebody with this genetics not get it, whatever it is, and why does somebody with the same genetics, get it tenfold? And it is because of all of these influences that we have through our diet and lifestyle and our mindset.
Yes, absolutely. I've finally read, I know it's been out for a couple of years, just read David Sinclair's book, Lifespan, and his description of epigenetics was sort of the best I've heard so far. Is really good. So I'll drop that as another recommendation if people are interested in that particular topic. As we, kind of go, kind of survey here functional medicine and talk about gut and elimination diets and thyroid and vitamins and things like that. There's a few other things I want to touch on. Going back to gut for a moment. Can you talk to us about this? There's some people are big advocates for probiotics, and some say, well, you can't really do much with probiotics because they don't colonize, and you need prebiotics. So you feed the bacteria to there. Can you tell us your take on that, prebiotic probiotic discussion?
Absolutely. So, back in the day, I was very into the paleo community, and one of the first speakers at a conference called PaleoFX that now is no longer, but I think was around for about 10 years. And every time I spoke, people would run up to me afterwards like, oh my God, I'm taking all this kefir and prebiotics and all this stuff, and I'm just like, I feel horrible and I'm bloated. Well, that is because many of these people had SIBO or Candida. And I like to think of SIBO and Candida as little fish in a fishbowl. And as you're giving them food, they're going to eat it. It's when you have your microbiome and you throw in a bunch of food, which is what prebiotics are, it's food, it's going to feed the good guys, but it's also going to feed the bad guys. So my philosophy and my experience in working with literally thousands of people is you've got to get these infections out first. So, and again, if you want me to, I can walk you through the 4R program, but I use a 4R program to get rid of these infections. I use the supplements I spoke about. And then after you've done that, yes, prebiotics are a great thing to reestablish your microbiome and to feed the good bugs in there. But if you start out and you have dysbiosis or an imbalance, that's the last thing you want to do. And that's the same when people come in and they're like, oh, I have a 100 billion unit probiotic and I have a 30 billion probiotic. And I recommend the 100 billion unit probiotic when you're dealing with Candida, when you're trying to overcome something. But in my probiotic, I have lactobacillus, which is one of the main strains that we have in our gut. Well, with SIBO, lactobacillus is often overgrown. So it's the concept of too much of a good thing is a bad thing. So if you give somebody who has SIBO, an underlying SIBO, 100 billion units probiotic, they're going to get bloated. They're going to feel bad. They're going to say, this isn't for me. So it's one of the telltale signs that when I hear that likely something's going on. And that's why in that case, I give people a stool-based probiotic. So I am a proponent of probiotics. I've seen many, many times people overcome candida using the probiotics. I've seen changes in laboratory tests. I've seen changes in bowel functions and symptoms. So I am a proponent of probiotics. If you have SIBO, you want a soil-based probiotic. If you have candida or nothing else, you want to take a regular probiotic, multi-strain, high, CFUs. And if you're dealing with one of those, you want to avoid the prebiotics. You want to avoid the kombuchas. You want to avoid the sauerkraut, all of that stuff. And then after you have treated these infections and you're now at baseline, you want to begin to incorporate these. And then, going forward, these are excellent things to keep your microbiome healthy and vibrant and in balance.
That's good. I appreciate that insight there. And a couple other questions I want to just make sure we get to here. So if we're talking with someone who has neuropathy, so we just completed a study on neuropathy actually, which we'll cover in a future episode. But in learning about it, a lot of people talk about B vitamins for nerves. So I'd like to ask you generally why B vitamins are helpful for the health of nerves, and also call out a compliment to you because there's some literature around the forms of vitamin B6. So there's the most common one, which like you talked about sourcing and how people put these less expensive ingredients. The most common one that you'll see is pyridoxine on a label, whereas you have pyridoxal 5-phosphate, which is the active form. So that compliments to you for thank you for doing that. But that
Yes.
actually is relevant because that pyridoxine can build up and actually lead to or make worse neuropathy symptoms because of how it can actually accumulate within those receptors in neurons. But can you talk to us a little bit about the relationship between B vitamins and neurons first?
Yeah. So again, I'm the autoimmune thyroid expert. I don't know that I'm the neuropathy expert, but certainly with B vitamins, the reason that I have the premethylated forms is really because of working with so many people with autoimmune conditions, and many of them, like myself, have these SNPs, and that was really the reason that I put that in there. It can be extremely good for neuropathy, and it is a delicate balance, right? I mean, in any situation, too much of a good thing can become a bad thing. Now, generally speaking, B vitamins are not fat soluble. You can urinate them out. It's very difficult to get, toxic with B vitamins. I certainly had many a patient who were seeing neurologists and they were just checking their serum levels and freaking out and, would call me. And meanwhile, I have, sort of their metabolic test showing that they were perfectly fine and they were not having any symptoms. But I think it is important just to know that if you're a person dealing with neuropathy, is finding that balance of, having enough, but making sure that you don't have too much. And that's really, I think if you're dealing with a diagnosis, working with a physician, and, I always advocate a functional medicine physician, is, really helpful to do so that you can get the metabolic testing to kind of see where you are, and then also use your symptoms as, as a guide. And of course, if you have any kind of neuropathy, using the NeuFit. So that's how you and I met. I had some sort of crazy nerve thing going on in my foot and couldn't wear shoes, and went on vacation and was wearing Birkenstocks, and it went away, and came to see you. And within 3 days, it was all healed. I'd like to take credit for the baseline of having, a good solid diet and supplementation going on. But I personally do own a NeuFit. And so I think, that I believe wholeheartedly in the NeuFit. It's kept me out of trouble. And certainly when I moved away from Austin and couldn't see you all the time, invested in having one that I use, frequently. And of course, sing your praises to anybody that I can because of what it's done, for me.
Well, thank you. I appreciate that. Thanks for sharing your experience there. And in terms of that, the types of people that we're working with for NeuFit, I also want to touch on this real quick in terms of helping people heal. Of course, I mean, everything you touched on leaky gut and digestion, being able to eat protein, break down protein, and use those amino acids to rebuild it, is already is so important if we're trying to heal tissue and stuff like that. So I think there's a lot there that we've talked about that's already relevant. But one question that I hear mixed things on. A lot of people will say, "Oh, you have connective tissue. You're trying to heal connective tissue injury. Take collagen." So does collagen that you ingest become collagen in the body or not? What are your thoughts on that?
Yeah, I mean, I think that there is research showing, when it comes to fine lines, when it comes to hair, skin, nails. I don't know the research regarding if you have like a tendon tear or something, but I can speak to anecdotally people in my clinic. I can speak anecdotally to myself with collagen. Now we also have to talk about, the various types of collagen. I mean, like we have what we call our regular collagen, and that's mostly for hair, skin, and nails, and a little bit your gut. Uh, and then we have a collagen complete that has all 5 of the collagens in it. And so that includes the joint. So you need to be careful with what are you trying to heal and what are you trying to achieve, and making sure that you're getting that type of collagen. I don't know the studies on injury because I'm not working with as many people there. I'm obviously working with people who have gut issues, and then, aesthetically want joint issues, and then, hair, skin, and nails. But there are studies showing that ingesting it does work. And I can tell you across myriads of thousands of people that, they can see the difference in their hair, skin, nails, and in healing their gut. One other thing that I would speak to that is, I think, an incredible healing tool, and, might be something interesting for you to add into NeuFit, and NeuFits around the country, is hyperbaric oxygen. I just always have to give a plug, and, I don't get anything out of this, but I've seen the most incredible results with healing, and people that I got to a plateau with. I had a woman who was in a wheelchair and with autoimmunity, and just hit this plateau. I said, go do 20 sessions of hyperbarics and call me back. And she called me back and said, I'm out of my wheelchair. I personally, had a toxic mold exposure, and some of my autoimmune markers had gone up and they weren't getting negative. And I bought a hyperbaric machine and got in it every night for a year. I didn't change anything else, and all of my autoimmune markers went negative. So I, think that would be an incredible adjunct, along with, diet, supplementation, NeuFit, and then you add in, a hyperbaric machine. I just, think that could be an incredible synergy. And yes, they're the ones that have what are called the baby blues, and they're these big ones, and they dive you down deeper, and they're $100,000, and you can go somewhere and pay $150 a session, or you can get an at-home one. Look, they're not suggesting this is inexpensive, but for you, what you'd probably get is the $10,000 to $25,000 one, which is what I have in my house. And it doesn't dive as deep, but even the manufacturers of the machine told me, like, doesn't make a difference. And I can tell you, I have plenty of people who, have used them, and it doesn't make a difference. I mean, if you have the luxury of time and money and want to spend $150 a session, but anyway.
That's our friend Jason Saunders, who has his company is called HBot USA, does a lot of hyperbaric education, and actually on that topic right there, he has a great book, and he talks about how you can go in these less expensive, lower pressure tanks for a longer period of time
Mm-hmm.
and get about as much oxygen effect as you would by going in the higher pressure ones for a shorter period of time. It's sort of the cumulative time
Exactly.
there is
Yeah. Or
what.
you can get in it twice a day. I mean, when you have one at home, and OxyHealth is the one that I have, Hans, you can tell him I sent you. I don't get anything out of it, but actually I shouldn't say that. After I bought one machine, they then saw how many people I sent to them, and they sent me another bigger machine. So I shouldn't say that, but I'm good. I got 2 machines. And I'm not saying this to get anything out of it, but the getting in it twice a day. And they have a rent to own, or at least they did. That's what I did. I did rent to own. And you can get in it whenever you want, and you can get in it multiple times a day. And back to another topic, which is COVID. We got COVID last year around this time, and my symptoms were fine, but I had this lingering fatigue that I thought, oh no, I'm going to be the person, which was my biggest fear in all of this, that I'm going to be the person with long COVID, given my autoimmune history. And a friend said, get in your hyperbarics. And I did. And within a couple of sessions, this fatigue that was so overwhelming that I, was just exhausted, in 5 sessions, completely gone. So I have recommended it to many, many people with COVID and long COVID as well. And they too have had similar results. So it's just getting oxygen to your body. How does our tissue decline, and, how do we age? It's, lack of blood. Well, it's many things, but, lack of blood flow and oxygen is certainly on the list.
That's good. I appreciate you bringing that up. And that's a topic we have not covered yet on this podcast, but I think we'll have to do an episode. Maybe I'll call Jason Saunders, see if we can get him to come on and really educate us, do a deeper dive, pun intended, because it's sort of like diving,
right.
Scuba diving.
Got it. Yeah.
Do a deeper dive on that. But that's a great one. We also, just to make sure, people can have a few take home points on this. We talked about leaky gut and gluten, and that being kind of one of these things that can just sabotage for a lot of people. Trying an elimination diet, that can be a really big thing that's worth doing. If you're doing blood tests, seeking out someone who can order for you these ion panels and finding intracellular levels and getting a more sophisticated approach here. The source of your multivitamins, fish oils, and vitamin Ds are kind of some of these basics that we want to address here. Hyperbaric oxygen, that's a really good one too. So we've got a lot of good things in here. I appreciate you, Amy, coming on and just sharing this. You are a wealth of knowledge, and the information on your website is excellent. So people listening to this, if you do want to learn any more about these topics, especially autoimmunity, especially gut health, nutrition, toxins, and chronic infections, great resources there. Can you remind us one more time we'll share a link to the free guide there, but can you tell us again what's in that?
What's in it? I thought you were telling me the link. I'm like,
I
didn't see the email. Also, I wanted to bring up, since this podcast is going to come out soon, I believe it's January 6th, more info if you sign up, at my newsletter. We are in January going to do a Heal Your Gut Challenge, which I'll be a part of, and we're going to do it as a group. So if anybody's, kind of feeling like after the holidays they need that, or maybe it's just something that they need, of course, there's lots of resources, and you'll get this free ebook that has 35 gut healing recipes and a lot of information about how to heal your gut. You'll put the link down below for that. So that will be free as a guest or someone listening to this podcast. And if you want a deeper dive and want to kind of go through something as a group, we're going to be hosting that in January, I believe 6th, but I don't know all the details quite yet.
Awesome. Thank you for sharing that. Yes, gut health is so important because chronic inflammation is no bueno. Not good. Well, Amy, thank you so much. We'll share a link here to your website. It's great to get to catch up with you a little bit here, and I appreciate you coming on and sharing this. It's a new topic for us and one that's just so important. So I'm grateful to you. I imagine our listeners will be also. And thank you for the wonderful work that you're doing.
Yeah, thank you. Thank you for making NeuFit.
Thank you, everybody, for tuning in, and we will see you on the next episode.